Food poisoning, microbial etiology, non-microbial etiology, undefined etiology. Food poisoning, microbial etiology, toxicological infection, bacterial toxicosis, mixed. Food poisoning of non-microbial nature includes poisoning by food of animal and vegetable origin, poisonous in nature. Poisoning by food products of animal and vegetable origin, acquiring toxic properties under certain conditions. Poisoning with food containing chemical impurities. Toxicological infection. For the emergence of a toxic infection requires the ingestion of a large number of living microorganisms into the body, which in the human body produce a toxin, which mainly determines the pathogenesis of this disease. Bacterial toxicosis. The cause of bacterial toxicosis is the intake of a sufficient amount of toxin into the body with food. Conditions conducive to the emergence of food poisoning of bacterial nature. The ingress of microorganisms into food. Creation of conditions for growth reproduction of microbes and toxin accumulation. Not observance of conditions and terms of storage of food products. Insufficient hard treatment. For the emergence of food poisoning of bacterial nature, all three conditions are necessary. The absence of one of the conditions excludes the occurrence of poisoning. The causative agents of toxic infections as food poisoning are potentially pathogenic microorganisms, poorly explored bacteria, sources of microorganisms entering food. Man, a patient with inflammatory disease of the gastrointestinal tract in which potentially pathogenic microorganisms can be released into the environment. Healthy bacterial carrier of pathogens of food toxic infections. Animals suffering from inflammatory process in the intestine and healthy bacterial carriers. The products that most often cause toxic infections. Meat and meat products. Boiled sausages. Fish and fish products. Salads. Milk and dairy. The incubation period of toxic infections is short, from severe hours to 36 hours. Clinical picture: fever, dyspeptic disorder, nausea, vomiting, multiple loose stools. The severity of clinical symptoms depends on the type of pathogen. Bacterial toxicosis, botulism, staphylococcal intoxication. Botulism. The main properties of botulinum toxin are high resistance to the action of pepsin, trypsin, low temperature, acids, in particular to the acid content of the stomach. Botulinum toxin is destroyed by boiling for 10 minutes and 18 degrees after 30 minutes. The presence of 6 types of Clostridium botulinum A, B, C, D, E, and F has been established. The territorial distribution of different types is noted. So, type A prevails in the USA. In Europe, the majority of cases of botulism are associated with the type B, and the CIS countries, types A and B, in part E. Toxins of all types of total biological activity, but require the creation of different antibotulinum serums. Botulinum bacillus, spore-forming microbe, has a high resistance to various factors. Spores easily germinate, and vegetative forms produce botulinum toxin. Clostridium botulinum is a strict anaerobic. Anaerobic conditions contribute to the formation of botulinum toxin. The botulinum bacillus is found in the gastrointestinal tract of animals, rodents, and is released into the environment, mainly into the soil. A person can also excrete Clostridium botulinum. In the soil, the botulinum bacillus retains its virulence for a long time. Possible ways of getting Clostridium botulinum into food. Intravital heat. When from the intestine of animals or fish, more often rat, the botulinum stick gets into the meat. This is more often associated with the weakening the body and increasing the permeability of the intestinal barrier. Violation of the rules of catch and processing of red fish, animal trauma. Contaminated soil can be a source of botulinum bacillus in vegetables, mushrooms, and even fruits. The products that most often cause botulism: meat, fish, vegetables, fruit, mushroom canned cans, red fish, homemade fish, sausages of long-term storage, ham. Incubation period from severe hours to 10 days. Clinical picture. The main manifestations of botulism are ophthalmoplegic and bulbar syndromes. The first signs of the disease are eye symptoms: double vision, nystagmus, anisocoria, ptosis of the eyelids. Then violations of the swallowing act due to the paralysis of the soft palate are aided, dryness in the mouth. There comes a paralysis of muscles of the tongue, pharynx. There are paralysis of the muscles of the stomach and intestines. Stool retention, violation of the secretory function of the gastrointestinal tract. As a result, the action of botulinum toxin on the central nervous system. Anxiety, apathy, drowsiness. Botulinum toxin is a vascular poison. The walls of blood vessels are damaged. Their permeability increases. At normal or even low temperature, marked tachycardia is noted. The muscular system suffers mimicry is limited up to its absence. General muscular weakness is noted. In the final stage, a breathing disorder develops. The fate of the patient depends on the correct diagnosis and use of antibotulinistic polyvalent serum. Staphylococcal toxicosis. An acute disease resulting from the consumption of food and food containing Staphylococcus aureus. Sources of infection. Human. A patient with acute and chronic diseases from upper respiratory tract, rhinitis tonsillitis. During a conversation, sneezing and coughing releases staphylococci into the air, which can enter the foodstuff by aerogenic means. Animals. Mastitis-bearing animals, as well as in the presence of animals, dermatitis other, pustular skin lesions. Products that cause staphylococcal intoxication: milk and milk products, cream products, meat and meat products, fish and fish products, salads. The incubation period is 2 to 4 hours. The course of the disease is acute and rapid. It ends 1 to 2 days. The temperature in patients is usually normal or subfebrile, sometimes reaches 38 degrees. Characteristic pneumonia of acute gastroenteritis. nausea, vomiting, pain in the epigastric region and through the abdomen, short-term diarrhea, presence of signs of intoxication, tachycardia, cyanosis of mucous membranes. Prevention of food poisoning is aimed at excluding the causes and conditions of their occurrence.